Hello cruel world, my name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. You can call me the ominous Shahaminous. Now, an expert in intimate partner violence called Shannon Curry gave evidence in Johnny Depp's defamation lawsuit very recently against Amber Heard. And she testified in her evaluation 2 psychiatric diagnoses, which were borderline personality disorder and histrionic personality disorder. So what does that all mean? What are the typical features of both borderline and histrionic personality disorder? Does this actually reflect Amber Heard's behaviour? And what was the evidence put forward by Shannon Curry to suggest this? So I am a forensic psychiatrist and I assess people with personality disorders. I've diagnosed borderline and histrionic many times. I don't see histrionic very commonly, but I do see borderline personality disorder in offenders because they're usually quite explosive and sometimes they lose their temper in the midst of an argument and sometimes lash out and offend. But they tend to be accidental offenders as opposed to somebody like antisocial personality disordered people who kind of are career criminals. So let's start with the basics and then we'll get on to Amber Heard. What is borderline personality disorder? It's also known as emotionally unstable personality disorder, and there's lots of features. The main ones are as follows. There's this intense fear of abandonment, and sometimes the sufferer even goes to extreme measures to avoid this abandonment. And because of that, they have this pattern of really intense, unstable relationships. They're always falling out with people, explosive arguments, getting into fights. Maybe you know somebody that's a bit like this. Maybe they're a bit of a nightmare. The other thing they do is they tend to idealize somebody one moment, believing that this person's shit doesn't stink, and then suddenly switches on them and denigrates them and believes, and they can even be cruel in the way that they interact with people who they seemingly were loving the floor that they worshipping the floor that they were walking on only moments earlier. With borderline personality disorder, you get this rapid change in self-identity and self-image, and you can get these periods of paranoia or anxiety and even lose contact with reality. Plus there's impulsive risky behaviour such as gambling, reckless driving, sexual promiscuity, drug use. There could be self-harming, suicidal behaviour, self-injury, and also these massive mood swings. So there can be intense periods of happiness or irritability, and then suddenly they switch to anxiety, then they're happy again. But deep down, they have like this chronic feeling of emptiness. And when they explode, they can have these intense feelings of anger, losing their temper really quickly. They can be bitter, they can be sarcastic. Sometimes, as I said, they can get into physical fights. Does any of that sound familiar? Do you know somebody that fits that diagnosis? Have you yourself been diagnosed with borderline or emotionally unstable personality disorder? If so, let me know in the Schmoment section below. Let me know your thoughts, your experiences, my Psych for Sore guys and girls. Okay, quickly onto histrionic personality disorder. So these are people who are basically exhibitionists. They constantly seek reassurance or approval. They're excessively sensitive to criticism or disapproval, so they take things really personally. And they have their pride in their own personality, which is not bad, but there's an unwillingness to ever be wrong or an unwillingness to change. And sometimes they can be inappropriately seductive in terms of their behaviour. But basically, it's all about craving attention. And also there can be a rapid shift in their emotional state. And finally, they tend to blame people for their failures or for disappointments. It's never their fault. It's always somebody else. And they do this in a really dramatic and emotional manner. To me, this kind of reminds me of a lot of the people that go into like X Factor or Britain's Got Talent who don't have talent. I'm not saying that everybody that goes on that show is like that. I'm not saying that. It's those people who, I'm sure you know what I mean, who clearly don't have talent and they just want to be the center of attention. They love the limelight, but they don't actually have any substance behind their abilities. So Shannon Curry said that Heard, age 36, displayed a reactive, overly dramatic presentation, and she used words like magical, wonderful to describe events. And she said that Heard tended to flip between being a princess and being a victim. So if that's true, if that is how she's reacted, and let me know if you can match that behaviour with what you know about Amber Heard, then absolutely, that definitely reflects both of those personality disorders. Curry then said that people with borderline may be in reality very destructive, they can be dramatic, they can be erratic, they can be unpredictable, and underlying all of this is this fear of being abandoned, and that's why they want to be the centre of attention. And I completely agree with this. There is this fear of abandonment. In fact, I would add onto that, from my clinical experience, people with borderline often stay in relationships, or they encourage their partners not to leave, even if both of them are really unhappy in the relationship, even if it's an unhealthy relationship, even if it's a toxic relationship. To them, being in a relationship or not being alone is more important than whether the relationship is actually working or not. Again, if you've got examples of this, I'd love to know your experiences. So Curry said that borderline personality disorder represents an unstable personality with little access to self-regulation and marked by, and I quote, a lot of anger, cruelty towards people less powerful, concern with image, attention seeking, and are prone to externalize blame, a lot of suppressed anger that may explode outwards. So what's my thoughts on what she said? Well, I would agree with most of this. So as I've said before, borderline personality disorder is definitely connected with an unstable personality, but I'd go even further. It's also connected with an unstable mood. So that's a mood, as I said before, that can really change from moment to moment. Plus they have this shallow affect. What does that mean? So that means they don't fully really invest in any emotion. So when they're happy, they're only a little bit happy. When they're angry, they do feel anger, but it's not really prolonged. It doesn't last that long. They change their position very quickly. The other thing she said is there's a lot of cruelty towards less powerful people. I'm not saying she's incorrect, but it's not the experience that I've had. From my clinical experience of assessing patients, it tends to be in the context of arguments rather than people that are less powerful. Shannon also said that people with borderline are concerned with their image. They have this like uncertain image and they're always attention seeking. There's a lot of suppressed anger that might explode outwards. And I think I'd agree with that. So far, so good. I broadly agree with what Shannon Curry is saying. The next thing she said that was interesting was that anyone attempting an intimate relationship with such a personality would likely go from, and I quote, idolized to dumpster. And she said that Amberheard was typical of borderline personalities because they're assaultative as partners, they use threats using the legal system, they threaten to file for a restraining order, they claim abuse. And all of that is absolutely true. So what she's talking about, she doesn't use this word, but what she's talking about is splitting. So splitting is something very typical with borderline personality disorder. It's where somebody splits either a group of people, so like a mental health team, a patient typically loves some of the doctors and nurses and absolutely hates some of the other doctors and nurses, and there's nothing in between. So you're either amazing and an idol to them, or you're a worthless POS to them. And interestingly, this can actually bleed into the mental health team themselves. So the mental health team themselves can split. So the ones that get treated amazingly and are always praised for their care and their attention, they tend to like these patients and come onto the patient's side. Whereas the ones that are denigrated by the patients tend to find them a bit of a pain, find them really challenging. So the team itself actually splits in terms of its opinions on these kinds of patients. And she used the term that, again, she didn't use this term, but idealization is exactly that, idolized to dumpster. So they're either one or the other. So Shannon Curry also referred to somebody called Raquel Pennington, who is a yoga teacher and a friend of Amber Heard. And apparently Amber Heard punched her during a shopping trip. And Curry said that people with borderline personality disorders can devalue friends quickly. And I agree with that. It's absolutely possible, although I don't think you can necessarily make the assumption that that was the reason that she punched her. It depends on the whole context. So for example, if she was provoked or not. So going on to a bit more of the trial, the court was presented by various witnesses' recollections of the couples, specifically their disputes and their relationship dynamics. And I think it's fair to say that it was all pretty twisted and it's all very convoluted and complicated and challenging. So I'll give you an example. Earlier on in the trial, there's this woman who's a manager of Johnny Depp's residence in the Bahamas, and she testified that she witnessed some disputes between the couples, during which, and I quote, Amber was telling him he was a washed-up actor going to die a fat, lonely old man. Wow, Amber, your words cut deep. However, moments later, when Depp tried to leave, Amber Heard was observed hugging and kissing the actor, begging him to return. So again, this is all very typical of borderline. There's this unpredictability, there's this emotional instability, which, as I said before, borderline is also called emotionally unstable personality disorder, so the clue's in the title. Amber Heard claims that she suffered from post-traumatic stress disorder as a result of the abuse that she faced from Depp. So this is not a personality disorder, this is a mental illness. And Curry said this is one of the easiest psychological conditions to fake. I'll give you briefly my thoughts on this. Again, I've not assessed Amber Heard in person, but I think it's very unlikely that she's got PTSD, and I'll tell you why. PTSD is often overused, it's often appropriated, a bit like depression is overused when somebody's just got a low mood. But actual true PTSD is when you have a trauma that's life-threatening. So by definition, what has had to have happened to Amber for her to have got this diagnosis must have been life-threatening. And I don't think anyone's saying, even her accusations are not saying that, Johnny Depp almost killed her. So she might, if he did abuse her, and I'm not saying that he did, but if he did, I'm sure it was distressing, I'm sure it was upsetting, but it's not life-threatening. So she might have had like intrusive memories and she might have been very upset by it, but I don't think she's got true PTSD, which is like reliving the experience, avoiding the situations that remind you of the experience. So somebody with PTSD typically would want to leave the relationship, as opposed to somebody with borderline who would typically want to stay in the relationship. So what I'm saying is I would refute politely the diagnosis of PTSD. Okay, let's get on to another interesting bit. So Depp's lawyers said that Amber Heard faked injury to damage Depp's reputation. Before I tell you more about that, I'm just going to quickly introduce you to this channel. My name is Dr. 𝐂𝐿𝐻 Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders in courts, in prisons, and in psychiatric units. I give expert evidence in criminal trials. This channel has a smorgasbord of videos related to true crime with a twist of psychiatry. If you're interested in this kind of thing, I've done a video on what is a personality disorder. And because I got some flack from that video, quite reasonably, some people are upset because they think that it's not fair to label somebody with personality disorder. I've got another entire video about if it is damaging to label somebody with a personality disorder. If you've got experience in any of those things, I would like to know what you think in the schmoment schmeckman below. Let me know. Have you been diagnosed and do you think it was fair? Okay, so going back to what I was talking about before, faking injuries. In the trial, a Los Angeles police officer named Melissa Saenz testified visiting the Los Angeles penthouse where they lived in May 2016. And this was just days before Amber Heard filed for divorce. And she showed up in the courthouse to seek a restraining order with a large mark across her face. And she said that it happened because of a fight with Johnny Depp that night when the police showed up. But Officer Saenz said that even though Amber Heard was crying when she went round that night, there was no evidence of injury. So it suggests, or Depp's lawyers at least, are suggesting that Amber Heard faked her injury after the event in order to damage Depp's reputation. Okay, so here are my final thoughts on the whole Amber Heard Johnny Depp case. I don't know the facts, and well, we as a collective don't know the facts. They're coming out slowly in this trial, so we can't say for certain what kind of abuse there was, who abused who. But with the information available, if the accusations are true, and if what Shannon Curry says is accurate, then absolutely this behaviour is definitely in keeping with borderline personality disorder and, to a lesser degree, I would say, histrionic personality disorder. So as I said, very impulsive, damaging actions without thoughts for the consequences. That's very typical in borderline. The other one last thing that I wanted to say is that there's something a little bit, I don't know if dodgy is the right word, but a little bit uncertain, unclear, unfair, vacuous, vague, nebulous. Sorry, I'm just spitting out adjectives here. There's something a bit dodgy when an expert is giving evidence. So if you diagnose a patient to help them, then it can be helpful to diagnose a personality disorder. It can help people understand that they're not alone and that this is a recognized kind of syndrome, and it can help them find the appropriate treatment, such as therapy. However, if in this situation, if you're in a court case and you're trying to diagnose the supposed victim and or perpetrator, then it's a bit of a sketchy area. It's a bit of the skating on thin ice, because it's not really objective. You're trying to look for evidence to make this diagnosis so that your client, i.e. Johnny Depp, will come out looking better. So I just wanted to raise that as an issue because I think that it needs to be put in that context. Do you think that matters? Let me know in the comments section below. And the other thing I'd say is that personality disorders are usually diagnosed not just with one psychiatric assessment, but with lots of personality inventories. Often the person making the diagnosis, the psychologist or the psychiatrist, will meet with the clients, patients, family members, etc., and get lots of detail from them rather than just picking out individual bits of behaviour. So I guess what I'm saying is everything has to be taken with a pinch of salt. That was my final thought. I wanted to get that off my chest. Watch the rest of the videos on my channel. I'll put some links down to some interesting videos. Have a blessed weekend. Stay euthymic. Buy my goddamn book. And do not forget, I love you.